Some of the most important ways to keep the eyes young: one, we have so much dry eye because we use tablets, we use phones, we do a lot of reading, a lot of driving. In Houston, we have a lot of air conditioning all the time. Each of those results in either more evaporation because there's air flowing, or more evaporation because we're not blinking enough. And that's not only the watery component of the tears, but that can also be the oily component to the tears. If you know oil sitting on top of water, the same thing happens on the eye. And as a result, when we don't blink enough, those glands don't get pumped with the musculature of the blink. So more evaporation can occur, and dryness can occur. And when you walk barefoot, you develop calluses. When you exist with dry eyes, and sometimes it's so dry that you don't even notice it that much, but over long periods of time, the eye can develop effectively calluses too. And we call this EBMD, or epithelial basement membrane dystrophy. And it results in these micro irregularities that both change how the tears sit on the eye and change how light goes through the eye, kind of like a warped window. So one of the first steps for many patients, if they're going to have cataract surgery or a refractive lens exchange, which is basically when you do cataract surgery to help make the vision clearer by replacing the lens, even though it's not a full-on cataract yet. One of the first steps is often to make sure that the clear windshield of the eye, or cornea, is in fact clear with a good curvature. So one thing is to make sure that the eyes are not dry. And if you need teardrops, use them. Use the gentlest stuff you can find. We love preservative-free teardrops. Another thing is UV protection. Absolutely crucial. Not only the eyelids and the surface skin, but also inside the eye. UV light has been associated with developing cataracts faster, and it can result in harming the retina, which is like the film inside the camera. That's the back wall of the eye. So between lubrication with artificial tears if you need it, and UV protection, those are the two external sources. And lastly is the rest of your health. The eyes have the same blood vessels that are in every other part of your body. We call this microvascular health, and that's why kidneys, heart disease, and then brain disease, or dementia often, can be connected with small blood vessels. So the same things that make you lose vision are the things that have problems with all the other organ systems. So diabetes, high blood pressure, all of those things need to be controlled well, because the vision is just as crucially dependent upon good blood flow.